That is a very good question. I'm going to use this study to answer it, but I want you to think about some follow-up questions afterwards. The absolute risk reduction of COVID if getting vaccinated is extremely low. It's about a little under 2% or even less than that when you look at these numbers here. But when you look at the relative risk reduction, especially when we're talking about Pfizer or Moderna, the main vaccines that were used, it's upwards of 96%. That is a huge drop. And it's because of the way that they studied it. When they did these vaccine trials, they only followed up with people for 2 to 3 weeks afterwards, saw of those that didn't get the vaccine, how many got infected. Of those that did get the vaccine, how many were infected. So the numbers weren't that high to begin with. Additionally, they were only looking at symptomatic COVID cases. So to essentially go from 170 people that would have gotten infected if they didn't get the vaccine to 17, that's a very big jump, although the numbers themselves are not that high compared to the world population, for instance. Now, follow-up question. How many lives were saved because of the COVID vaccine? Globally, from 2020 to 2024, it is estimated that roughly 2.5 million people were saved because of the COVID vaccine. And the authors admit that this is a conservative number. The actual number is probably a lot higher. And it highlights, just as a vaccine is meant to prevent us from getting the infection, it is also meant us that if, God forbid, we got the infection, the symptoms from it are much, much, much less, and thankfully protect us from giving it to someone else. The last question, was the COVID vaccine safe? They looked at things like autoimmunity, cancer, whichever you want to look at, and collectively the evidence supports that it is safe and effective. So if the vaccine is safe and saves people's lives, this is a net win. So although your question is fantastic, you gotta keep asking the follow-up questions to determine how beneficial is a medical intervention. Don't get scammed. Take back your health.